This meeting is being recorded.
Okay, cool. All right. What is the nurse's role? Next one. What's the nurse's role in the community? Think back to community-based nursing, community-oriented nursing. What's the difference? And what do we think they're going to ask about the nurse's role in the community? What different roles do we talk about in the that nurses might have in the community throughout this whole term? I'll start. Hospice nurse.
School nurses.
School nurses.
Health department.
Yeah. What else? Occupational health nursing. Okay. Okay. Assess income. Why is that important? What do we determine throughout this whole class? Why is assessment of income important?
It affects the type of care that they get.
What else does it affect? Easy answer, everything. If you are in poverty, what is affected?
Your health.
Healthcare. What else? Food.
Nutrition.
Education. What else? Crime, maybe? What else? Remember what we talked about in community, that financial stability is the driving force, right? In everything that happens in the community. Okay, what's the next one? Number 6. This comes under the section of ethical, legal and ethical leadership. What do we think community clinic financing is all about? I think this has to, I haven't seen the questions. I think this has to do with insurance. I think this has to do with the difference between Medicare and Medicaid. What's the difference between Medicare and Medicaid?
The Medicare, you have to have a need for a nurse, like a skill.
Mhm.
And then the Medicaid is just like any kind of
Which one is funded by the federal government?
Medicaid.
assistance.
Which one?
Medicaid.
Nope. Medicaid is the states.
Medicare.
Yep.
Medicare, yeah.
Which one is income-based eligibility?
Medicaid.
Correct. And what's the criteria for Medicare too? I'll give the first one, age.
65 and over.
65 and over, or
Homebound.
any age with a disability. Right? You remember that?
Yep.
Okay. Next, now we're under a section of, say, research and theory. They are going to ask about assessing trends and patterns. What's that all about? What word does assessing trends and patterns come under? Surveillance, right? That's in the study guide. So they are going to ask about surveillance. That's what assessing trends and patterns is. Okay, what's an ecomap? What's the difference between an ecomap and a genome? Again, I didn't pull these topics out of thin air. This is what's on previous HESIs. So there must have been a question about a family ecomap. I don't know what the question was, but what is a family ecomap?
Is that represents the family interaction?
Yep. Social interaction, how the family interacts with the community, right? Your current social structure of a family engaged with the community. Then what's a genome? That was taught together. Genogram, what's a genome, genogram? What does that have to do with? Okay, so make a note. If you don't know what a genome is, go back and look. So you can go back to your book, type in the word genogram or genome, and it'll take you to the section of the book where that is. Okay, what do we think when we're talking about a voluntary agency? I think Red Cross. That's what I think about. Right? A volunteer agency, maybe that's helping with a disaster, helping with a health fair. And there's a section in your study guide about all this is in your study guide. Okay, there's a section in your study guide about voluntary agencies. Okay, we're still in community health. We had a whole chapter on program goal setting. Talk to me about program goal setting. What does that mean?
Like you do your assessment and you set the goal.
Mm-hmm. And who are you doing programs for? What kind of programs are in the community? Where does it depend on? How can you answer what kinds of programs are in the community if you haven't done your community assessment? And you don't know, what the issues are. So this particular number 10 is your nursing process question, right? I can tell you that the HESI is heavily focused on nursing process, okay, which is your ADPI. It's heavily focused on your levels of prevention, primary, secondary, tertiary. And it's focused on safety, your ABCs, and brings in a lot of med-surg skills. Okay, so you're gonna program goal setting, okay? Where does that fit into ADPI? That's what you need to think about there. I think, again, I don't know these questions. I just know the topics that are being introduced as questions. Okay, I think of number 11 where it says advisor role. I think when I think about that, I think more about advocacy. Okay, why is it important that we play an advisor advocacy role in the community? Okay, and then outcome evaluation. What are we talking about here? When do we do outcome evaluation? What are we evaluating?
Their treatment.
Or a program that we've done,
Okay.
right? So let's look where this is coming from. It's coming from the endocrine system. So what might we be evaluating? What's very prevalent in the community that has to do with the endocrine system that we're going to be
Diabetes.
Yep. Okay, so outcome evaluation. What might we be evaluating? Maybe we did a program on how to care for your blood sugar, care for yourself, teach them how to do blood sugars, how to give insulin shots, right? So outcome evaluation is how well they did. Well, it's part of the nurse. It's the E of the nursing process, evaluation. Okay. Community risk findings. We talked about this at the beginning. What are we going to, what kind of risks are in the community? What are the risks for that whole first section of your study guide goes through infants, children, adolescents, right? And what the risks are, risk findings. Okay. Next, we bring in the cardiovascular system. Why is blood pressure screening important? Why are we screening healthy people? What are we doing there? Is that primary, secondary, or tertiary?
Secondary,
Yeah, why?
because you're screening their pressures
Right.
prior to
Right.
disease.
And why are we screening healthy people? What are we trying to do? Early identification for early intervention. Okay. Why might we be teaching and talking number 15 about exercise and hydration? as it relates to cardiovascular. Why is that important? You guys, is everybody around? I mean, I really need you guys need to know this. Everybody's quiet. What's going on? I need you to answer these.
You're breaking up really bad, so it's hard to
Oh,
keep up with it.
I'm breaking up. Okay.
Like,
All right.
yeah,
that
and I
better?
could hardly hear anything you're saying. So,
Okay, well then, okay. So
no,
hang on. Have you guys heard anything I've been saying or what? Give
You
me
break up every
I've
so
been-
often.
Yeah, I hear you, but you do kind of break up a little bit.
Let's see. Is that better?
yeah, that's better.
Used. Hang on a second. Can you hear me now?
Yes.
Yes.
Is that better? Can anybody hear me?
Yes.
Yeah, we
Yeah,
can hear
that's
you.
better.
Okay, that's better.
Oh, well, I just don't know how much of what the last half hour you've missed or I've missed. Okay, so somebody please stop me if you can't hear me, okay? Please. Okay, the last, can everybody hear me?
Yes.
Yeah, you're good.
Okay, the last part
You're
of,
better.
thank you. The last part of community is under skills, safety, leadership. Radiation exposure, what is that? What are the risks? How can you be exposed to it? What do we do?
Um,
Should it be education with occupational health, depending on where
Yep.
you're at?
Yeah, excellent. Yep. Okay. That is also in the study guide as well. So we built this study guide, your 56 pages. Has anybody, let me take a poll here. Has anybody gone through the study guide yet?
I've looked at it.
I've looked at it.
Yeah,
Just
I've looked at it.
by show of hands, how many people have looked at the study guide? Okay, I have a lot of people that are not on camera. So has anybody got through the whole study guide yet? Just to briefly go through it. Okay. Okay. So you'll see that what we're doing now is covered in the study guide as well. Okay, let's move on to vulnerable populations. This is another section. Okay, so what we found in reviewing previous HESIs with regards to vulnerable population, here's some of the questions, topics that were asked about. Homelessness, okay, cold exposure risk. What are we thinking there? What potentially could a homeless person
Frostbite?
coming into your clinic that has a cold exposure risk, maybe what would they present with?
frostbite.
Are we
Upper
talking about temperature or like
infections.
respiratory?
Say that again, Allie?
Is it temperature cold or like a respiratory cold?
I don't know.
I'm confused.
I have no idea. This is just a topic that was introduced into the HESI. So it says homelessness, cold exposure risks. So we have to figure out what might they be asking about. I was thinking more of what if a homeless person has been exposed to the cold and they show up on your door, what are they at risk for?
Pneumonia.
Pneumonia, frostbite,
Frostbite.
what else?
Hypothermia.
Absolutely. Skin breakdown. Yep. Okay. What about migrant worker risks? Respiratory. What are we thinking there? What do we learn about migrants? What's the largest risk to migrants?
Pesticides.
Pesticide exposure.
Poisoning.
Exactly. And so if they come to your clinic and have been exposed to pesticides, what might they present with?
Nausea,
Fever.
vomiting.
Exactly. Exactly. Okay. What about community resources in the rural community? I'm on line 5. What do we want to know about that? Probably, I'll start. One is there's probably much less resources in the rural community, right? Than urban. And so what are the other access issues to the rural community?
Lack of transportation.
Exactly. Lack of, right. What else? Lack of specialty care.
Don't they not usually report health issues or other things because it's such a small community too?
Mhm. You know, we talked about that in the violence chapter, domestic abuse, child abuse. Um, there's not a lot of resources to deal with that in the rural community, so they're less likely to come forward. And if there is somebody to deal with it, they don't want everybody knowing their business. Remember we talked about
Right.
that? Okay. We talked about cultural competency. There's a couple. Let's see, the next 3 lines are about cultural, spiritual, Hispanic. No, we need to know about the Hispanic. Remember that nice little chart we had in the book that went all through the Hispanic population: verbal communication, nonverbal, healing. So HESI was focused on the Hispanic population. They also introduced the topic of Islamic faith. What might they want to know with these different cultures? How do they expect to be communicated to? I don't know. How do they expect eye contact to be? How do they expect, closeness to be? Do they want you like up close in your face, or they want to be a distance from you? Culturally sensitive teaching. Why is that important?
Because you need to understand the best way to take care of somebody depending on what they prefer in their culture.
Right. Because if you don't, what might that create?
Mistrust.
Mistrust, issues with communication, issues with, the plan of care, carrying out the plan of care. Okay. Number 9 is battering communication. Okay. What might that be? What I think about with that is, what is an effective way to communicate and gather information with maybe a victim of violence? And what
Not
are
to
those?
be judgmental.
What?
Not to be judgmental.
Right. What else do you remember about that?
Separate them from the
Mhm.
abuser if they're with them.
Mm-hmm. So I think what this is getting at is how to adequately communicate, gather the information you need with victims of violence in a positive way, in a healthy way, in a sensitive way, in an empathetic way. Okay, here, the next one, 10, we're pulling in some med surge here, right? Psychiatric, mental health, med surge, depression, grief. So home health and dying, what do we need to know? What's important to know about home health and the dying client? What kind of nurse takes care of that client?
Hospice.
Hospice. Yeah. Well, I'm just trying to mute whoever has all that background noise. Okay, who do I need to mute? I only have 17 people in here. Bummer. Okay. Wonder who left. Let's see. I know who came in. Joanne came in, and who else came in that was missing at the beginning? I just want to make sure I give you credit for attending. Joanne and Helen. Helen, are you here? Helen?
I saw her
I did
in the
too.
group at one point.
I did too, but then I don't see her. Okay, Joanne, you're here, right? Joanne's not here. Okay. 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 Home health, dying client. What do we study in class about the dying client and the hospice nurse? What potential issues are there with family and grief?
You should be aware of the cultural background.
Mm-hmm.
You should educate the family on what they should be expecting during the dying process.
What do you have? What if you have non-participatory family members or family members that might not understand what's going on? Is that a potential problem for the hospice nurse?
Absolutely.
Yeah.
What does she do? What is the?
Educate it the best way that they can understand.
Mhm. Okay. Let's see. We're talking about vulnerable populations. The elderly is definitely a vulnerable populations. Why do we have the topic of geriatrics and home nutrition? Why is that important? Or what
They
might
forget to eat. They forget to eat. They don't eat right.
They may not be able to provide the adequate needs to make a meal.
Mhm. Okay.
I'd say they're vulnerable because a lot of them have dementia, so they're easier to, like commit those kind of crimes against.
Right. They're much more at risk for, we have a whole page here of geriatrics. So that will come up there. Yeah. I'm thinking number 13 is pediatrics, abuse, health department visit. I'm thinking this is all about making sure that we understand that what the signs and symptoms of abuse are, whether it's kids, adults, elderly, right? That's what I'm thinking that is. How do you identify the symptoms of abuse? And remember, we are all what when it comes to abuse? What are we all?
Advocate.
Mandatory reporters.
Mandatory reporters. And what does that mean?
We have to report anything that we see
Mhm.
that may be abuse.
Do you go tell your coworker what you saw and ask them if you should report it or not?
No.
Okay. You're the one who needs to report that. You could talk about it with people, your coworkers or your boss or whatever, but ultimately you have to make the report. Okay. You guys know that, right? Okay. Disaster. This is all in your study guide as well. What did we see from previous HESIs about disaster? Okay. Well, natural disaster preparedness. Okay. So number 3, preparedness. What is preparedness? It's one of the cycles, part of the cycle, right? Preparedness. What do you think they're looking for when we talk about preparedness? What do we talk about in class of how
Alert.
we prepare people? How?
We do practice alert systems.
Yep. What about that?
Evacuation practice,
Yep.
having the supplies that you need.
What about the supplies? There was a whole box in the Red Cross box. What do we help them put together?
Well, they need to have 3 days worth of food,
Okay.
and it
What
needs to be checked every 6 months.
Yep. What about
Everyone
shutoffs?
needs
Know how to turn off utilities.
Yep. What else? One
everyone
more.
needs to know where it is.
Yep. Yep. Excellent. So that's how we as community, part of our job as a community nurse is to prepare the community for a potential disaster. Okay. Why does number 4 say cholera? This is in your study guide. Why are they asking specifically about cholera in the disaster section? And what is it? When you watch disasters unfold on TV, what are some of the first infectious diseases that pop up?
It's from polluted water, isn't it?
It's one of the primary first infectious diseases you'll see pop up after a disaster. Polluted water. And what is cholera? It's a GI bug, right? GI. Okay. Red tag. Next one is red tag. What's red tag? Disaster, red tag, triage. What does that mean?
Immediate attention.
That's deciding who you need to take care of first.
Correct. And there's a whole tag section in the study guide. I'll show you that. You need to know what is a green tag, what is a yellow tag, you know, who are the people that we can save, who are the walking wounded, who are the people we can't save, and how do you tag them? That's your triage job as a nurse in a disaster. Okay. Child development. Okay, this is screening programs. First one is screening programs. What do we screen for with kids?
Vaccines.
Yep. What else do we screen for?
Scoliosis,
Scoliosis. What's scoliosis?
curvature of the
Lateral
spine.
curvature of the spine.
How do you screen for it?
Have them bend, lean forward.
And,
Check aligning of the hips.
okay. How do we screen for immunizations? We ask them for their immunization records, right? To find out what they have done and what they haven't done. Right? I know in the schools we used to have, you know, the percentage of non-compliant, percentage, you have to, that's state regulated data. You have to be able to screen families of who's immunized, who's not. You have to be able to collect the data from the families so that you can accurately decipher who is immunized and who is not. Because in the event of an outbreak in a school or wherever, daycare, whatever, who are the important kids to go to first and talk to their parents? Let's say there's a pertussis outbreak or a chickenpox outbreak. Who do we have to go make sure they are notified?
The ones that don't have the vaccine,
Why?
so they'll be more prone to catch it.
Right. And we might be encouraging them to stay home until this, you know, outbreak passes. Okay. That's why we screen for childhood immunizations, or one of the reasons. Okay. We just went through this, well, hang on, let's go back. All right. Why are they asking about, hang on. Oh, I went all the way back. Screening programs. Okay. Diet and stress. Teaching diet and stress. What does that mean?
That can lead to obesity, stress eating.
Mhm.
Is that what you're looking for?
Yep. And is that primary, secondary, tertiary?
Primary.
Mhm. What if you were working with a group of obese kids? What is that?
Tertiary.
Tertiary.
Mhm. What if you were working with a group of kids that you screened and you identified them to be a potential risk for obesity, and you're teaching them in that capacity? Is that primary, secondary, and tertiary?
Secondary.
Okay.
Secondary.
So I just gave you an example of how education is incorporated into both primary, secondary, and tertiary. I do not want you to get thrown off when it says education and you just assume that's primary. Okay, education and teaching is performed at every intervention level. Okay, and we just went through why. Education with regards to primary is prevention. Education with regards to tertiary is we have early identified you to have risk factors. Now we're going to teach you how to stop the stop the process now so it doesn't get any worse and you don't turn out to have diabetes or obesity. And then teaching at the tertiary level is, okay, you have diabetes. Now we have to help you learn how to take care of yourself. Does that make sense? So do not get thrown off with the word education, right? When you think about primary, think prevention. When you think about secondary, think screening. When you think about tertiary, think management. Okay. Several people got tripped up on that with our last 2 exams. They saw the word education in the answer for, let's say, a secondary or tertiary question. And they said, oh, though that's not it. It can't be because education is always in primary. Okay, it's not. Okay, so that's my little mantra on that. Okay. What are we teaching in the pre-adolescent? What's important to teach in the pre-adolescent?
Sex education.
Yep. What else? It's on your study guide. Same with the next one, adolescent health teaching. It's on your study guide. I'll show you where that is.
Healthy eating habits.
Yep. On your study guide. Seatbelt safety. Why are we teaching seatbelt safety? Because it's the
Number one
exactly
cause of death.
at car accidents. Yep. Why are they asking about neighborhood safe houses? What are those and what are they about?
It's a safe place for children to go or families to go if they have nowhere. It'll protect them.
Mm-hmm. Okay. Why are
When
we
I was growing up, we had a McGruff house. They had like the sticker, remember the McGruff
yeah,
dog?
sure. Yeah. I have one that's down the street that is called the Carless House. And it's an old football player from the Broncos who his foundation put together. It's a safe house, but it's called the Carless House, but that's exactly what they are. And it was for pregnant women of abuse. By the way, vulnerable populations papers, I only have a couple more to grade. I've graded almost all of them. They are fantastic. The only thing that people got caught up on, and I don't know if I wasn't clear at the beginning, but when we went through the topic, you were not only to pick a topic, but it had to be, you had to do an assessment within your community. Okay, so I don't mean to get off topic here, but you have to do, like, if you're picking the homeless population, and it was probably half. So the other half does not have to listen to that if they did that, but there was many people who just picked a population and then did the whole population, like what are the stats on homeless population nationwide or teen pregnancy. And there weren't that many points taken off, but I had to take some off because the actual instructions were to pick a vulnerable population in your own community. Like I live in Denver. So what is the homeless population in Denver? What is the teen pregnancy rate in Denver? And then it gave you all the things. What's the population of Denver? What's this? So it was asking for a specific zip code, your zip code. What do you want to learn more about in your community? And that was the specifics that a lot of people just did a general. So I was surprised, wondering, was that something I didn't communicate? But it was right in the guidelines. But anyway, they were great. I mean, even if you did the homeless population in general or HIV population in general and didn't do your zip code, I mean, they were great papers, and I still have, I think, 3 left to go, and I'm going to finish those right after this class. So anyway, sorry to get off on that. Okay, why are we teaching about nicotine? Why are we teaching about lice? Why are we teaching about skin health? These are specific topics that came up. Nicotine, lice, skin health. Why is that important in child development? Are you teaching about those things?
Well, with nicotine, if you educate about the harms lifelong and give them an
Mhm,
actual future outlook on it,
mhm.
it's important.
Yep. Here's your scoliosis screening. Here's your ADH screening. Here's your eczema. What do we run into all the time in the schools with kids with regards to skin integrity and eczema issues? Acne, right? Immunizations, immunization rates. There must have been a question, there was a question that talked about hepatovax B allergy. Okay, and what does an allergic reaction look like? So this is, I believe, in your study guide, but if I were you, I would read up on what does an allergic reaction look like to the hepatovax B vaccine. Okay, and then conjunctivitis and ophthalmic meds are right under conjunctivitis. So what I'm thinking there is we want to make sure families, number one, have the money to purchase their conjunctivitis medication. And if they don't, where can we get family assistance for them? Okay, that's what I'm thinking there. What about lead poisoning, the prevalence? What do we know about lead poisoning? And why would they be asking about that?
Kids like to eat paint.
Mhm,
People living in older homes
exactly.
that have the paint that has it.
So what's a primary intervention for lead poisoning?
Get rid of the paint.
Nope, that's secondary. What's primary?
Educate the parents and the homeowners.
Yep, what's secondary?
Get
Getting
rid of it.
of the
Getting rid of
Screening,
it.
have
and
Yep.
then screening the kids for lead in their blood.
Yep, you could screen them to see what the level, and okay. And let's say one of the kids had a blood level high. So now they actually have lead poisoning and are presenting with symptoms. What's a tertiary intervention? Or what's your goal?
treatment and educate on why it happened.
And getting that lead level
Yes.
back down within normal limits. Okay. Geriatrics. I want to keep going because I want to cover two more things with you guys. Okay. Elder health assessment. Why are they asking about that? What's an elder health assessment? What entails that? What are you looking for? What are the potential risks?
See if they're safe in their home, if they're fall risk.
Mhm. When you go to visit them in their home, besides a health assessment, what other assessments can you do?
An assessment of their environment.
Safety, food, what kinds of things are risks?
Medication.
Medication. Yep. Abuse, big one. Signs and symptoms of elder abuse. That would be in your health assessment. And it's specific a little bit down from here. Community senior health screening. Why is that important? What kinds of things would it's talking, we're here. This is med surge, cardiovascular, integumentary system. What are we looking for in our community senior health screenings? Taking into account all of this, med surge, cardiovascular, skin. What are we looking for in our screenings?
Skin breakdown.
Skin breakdown.
If they have high blood pressure, if they have heart disease, if they have diabetes.
Yep. Next one is teaching skin health. Why is that important? Why is that really important?
Your skin is your first line of defense.
Right. And especially for the elderly, right? And here, home environment safety. What are we looking for? Slippery rugs, furniture in the way, maybe refrigerators that don't work, maybe household items are in the wrong place, cleaning.
Good lighting.
Exactly. Home care referrals. Why are those important? Why are we doing home care referrals?
Because they might need help at home with their medicines, or
Yep.
they might not can manage it themselves.
Yep. So if you're the case manager working in the hospital and you're the discharge planner and you're sending people home, especially the elderly population, that's what we're taught. That's the topic we're talking about right now. You need to do a full assessment of what needs they might need at home. Do they need medical equipment? Do they need help with their medication? Do they need food preparation? I mean, what condition are they in, and what ADLs can they perform on their own and not? Okay. Diabetic foot care. Why are they asking about that? And what do you want to know? What should you know about that?
They need to look at their
Affect
feet every day.
And this is under basic nursing skills, hygiene, safety, diabetic foot care. Right? So you're working with them with regards to hygiene and safety. Okay. And safety meaning that if there's any issues with their mobility, those have to be assessed and dealt with. Whether they need any supportive equipment, right? That's what I'm thinking they're wanting to know. And then same with eliminate under basic nursing skills with regards to elimination, mobility, safety. What does Parkinson's home care look like? What things do you have to consider with Parkinson's home care? Or a client with Parkinson's, what do you need to consider as far as what they will need in their home care? Well, highlighted here is mobility and safety. Okay, why is orthostatic hypotension trending with HESI? What do we need to know about that?
If they're on medicines that could cause that, then they need to make sure they rise slowly, or
Exactly.
safety for when they're taking the medicine.
Perfect. What would be a secondary prevention with regards to hypertension? We kind of already talked about this. What are we doing in a secondary prevention? And what are we doing secondary with regards to hypertension? We are what?
Screening if they have a history of hypertension in their family.
Screening. Yes, screening. Okay. What do we know about cardiovascular disease in African Americans?
They're at
They're
increased
higher
risk.
risk.
It's higher.
Why? I don't know if we need to know the why, but what if the question is, we know that cardiovascular disease is more prevalent in the African American. Please select all the reasons below that apply. What are the reasons?
Their diet.
Genetics.
Yep. Okay. Why are we doing lipid screening in the geriatric population? This is under cardiovascular and endocrine. Why are we doing lipid screening?
Treatment goal for spina bifida.
What?
Heart disease prevention.
Possibly. Yep. What are some other reasons we might be doing lipid screening?
Oh, the kidneys.
Monitor the risk of cardiovascular disease.
Achieve optimal
Blood flow.
urinary function.
Oh.
Yep. Kidney functioning. Why are they concerned about elderly relocation? What did we learn about that? There was an exam question about that. What are the risks for elderly relocation? What are we looking at? It may be perfectly normal that they're moving in with their kids, for whatever reason, perfectly normal, no risks, or nothing to see here. But what are the risks?
Abuse, like they're taking their money.
What exactly? What else?
Possible abuse from their children. Using money
Neglect.
financially.
Yep. Neglect. Yep. And we learned in our exam question that things like being sad about losing their social group, yeah, that's a bummer, but that's part of relocation, right? Maybe having to change healthcare companies, that's part of their relocation. Okay, but what isn't normal with regards to the relocation? Well, like you just said, if they were very self-sufficient and independent and autonomous and managing their own finances, that's great. And now they're not, well, that might be a red flag. Okay. COPD, ADLs at home. What do we need to consider here?
Getting with a case manager for needing oxygen tanks at home.
Yeah. What are the needs? What would be, I'm thinking, how are ADLs at home impacted with COPD?
Teaching them appropriate rest measures.
Exactly. Okay. Musculoskeletal system, tertiary prevention. What are they talking about?
They're talking about preventing like symptoms for people that already suffer with diseases that affect the
Uh-huh.
musculoskeletal system.
Yeah. So let's assume they already have a musculoskeletal disease. What would those be? Just throw out a couple.
Like arthritis.
Okay, arthritis. Excellent. So what would be a tertiary?
Parkinson's?
What would be a tertiary prevention for arthritis for the elderly?
Pain management, safety for falls.
Physical therapy.
Exactly. They already have it, and now you're trying to help them maintain the best quality of life possible with whatever condition they have. Excellent. Why are they asking about long-term care fall prevention?
Because it's such a
one of the-
huge thing.
Yeah.
You know what I mean? Like it's such a common thing in facilities.
Falls, right.
And it's causes all kinds of health problems and stuff.
There was a question or something was asked about Meals on Wheels. So what is Meals on Wheels?
A food delivery service
For?
The elder.
Disabled people that qualify for it.
Why are they asking about teaching elderly clients about a home diet if they have ascites? I'm on line 28.
If they have ascites, I automatically think alcoholic, and if they're an alcoholic, then they're at high risk for nutritional deficit in my mind. So I'm just thinking that that's a priority.
Yep. Why are we teaching elderly in general about, I'm on line 29. Why are we teaching elderly people in general about diet?
So that they can get the proper nutrition.
Because
they may not be able to afford organic food, so they need to know what foods they can eat.
They may not be able to remember to eat. Right?
Yeah.
Okay. Okay, let's get to our last topic here, infectious disease. Okay, what do we know about line 3? What do we know? Why are they asking about newborns and vertical transmissions? What are we concerned about?
SIDS.
HIV.
Nope. What is the STD that we're concerned about with regards to transplacental? What?
Syphilis.
Correct. Yep. And
What
remember
about? Oh wait, I'm sorry.
Remember we talked about the difference between STDs that were bacterial and viral. What's the difference? Bacterial can be treated. And viral cannot, but we were specifically concerned about vertical transmission from mom to baby with regards to syphilis, right? Remember we talked about that? What's vector-borne diseases? This is under the This section of infectious diseases, most of it has either pathophysiology or med surg or both. So this is where we're pulling in your med surg. So this is obviously community health. We're talking med surg, skin system, immune system, hematology, vector-borne diseases. Okay, what's a vector-borne disease?
That's like a disease from a mosquito or a tick.
What kinds of vector-borne diseases do we talk about?
Lyme's disease?
Yep.
West
Which-
Nile virus.
Yep. What's Lyme disease? What's the vector?
A tick?
Yep. What about West Nile?
Mosquitoes.
Okay, what do they mean when they talk about CDC reportable diseases? What does that mean? There is a standard list, a standard expectation that certain diseases are reportable to the CDC. And then that filters down to the state. And then that filters down to the local. So when I was in school nursing, I had a complete list of reportable diseases to the health department. Okay, they have a list of what's reportable to the state health department. So I think the importance of them pointing this out is acknowledging that there are reportable diseases that are expected. Remember, we talked about the reporting. Is it active? Is it passive? Is it the nurse in the schools reporting it? Is it the emergencies reporting it? Remember that whole conversation? Okay, what does pathophysiology and med surg look like with regards to endemic symptoms, possible terrorism? What does that mean? Anthrax incubation, what does that look like? Respiratory SARS, what does that look like? This is all in your study guide. Okay, we're under the topic of infectious diseases. Okay, so we talk about anthrax, SARS. I'm thinking they want to know it falls under trauma emergency. I mean, these are listed out like you do with your NCLEX questions, right? Where you have, it just goes, you go through and pick your subcategories. Okay, so we're talking trauma and emergency with anthrax incubation. What do we think they're asking? Maybe what do they present with? What symptoms they're going to have, and how do you treat them? That's in your study guide. Okay. Here's a pathophys med surg line on the reproductive system, and what are pelvic inflammatory? What's PID?
Pelvic inflammatory disease.
Okay, and what are the risk factors?
You won't be able to have children.
Maybe too many sexual partners. What are the other risk factors? Okay, I would study up on that. Find the risk factors for pelvic inflammatory disease. What's the epidemiological triangle? This is triad, means triangle. What's an agent? First of all,
The host, agent, and environment.
okay, what's the agent?
The actual.
The things causing whatever's causing the
Bacteria.
infection.
The disease that's caused the infection, the agent. What's causing it? COVID. What's the host?
The people.
Okay.
An animal.
If you're an immunocompromised person, are you an agent, host, or environment? You're a host, right? Because a host can have a compromised immune system, right? Can you guys hear me, or did you all just get quiet?
We can hear you.
Okay. Why is the environment important? Why does that play into the triangle?
Because it can tell you who all might be affected.
And how sick they get or how sick they don't get, right? Internal, external environmental factors. Okay. Flu vaccine. Why is this a priority? Consider a priority. with regards to infectious diseases, and why are they asking about it?
It's a primary prevention measure.
Yep, good. Yep. Is the flu vaccine one of the most preventable actions you can take with regards to getting the flu, or a lesser case of it?
Absolutely.
Yeah, absolutely. Okay. HESI's big on TB. You're not going to get away with being asked about, you'll be asked about TB. That's why there's a whole section in the study guide. TB, when do you read the results? A week? A week?
48 to 72
48 to
hours.
72 hours.
Okay. And how big is the circle?
If it's bigger than 6,
Who said 10? 10 is the right answer. Okay, why do you do a screening x-ray for TB?
If they have a positive test, skin test,
Yep. Okay, but why do you do an x-ray?
so that you can see if they have it in their lungs.
Exactly. Exactly. Okay, that's the end of that trending document. Okay, so I don't know. I hope that's helpful for you, because that is actual topics that we've seen on these HESIs that we reviewed. Hey, Lewis. So hopefully that's helpful to you guys. Those are topics that came up in actual HESIs the last 18 months. Again, I don't know the questions, but I do know the trend. I do know the topic. Okay. So let's go through the study guide. I'm not going through 56 pages. I'm just showing you how it's organized, so it's not so overwhelming. Okay. So here's your front page. Apply principles of clinical judgment, which is your med-surg, your nursing process, your med-surg principles, safety and delegation. Okay. Hopefully, you understand that this is not an all-inclusive study guide, right? Questions are like NCLEX, they're randomly selected. Okay, so it's super hard to predict what questions will be on the exam. All right, so hopefully you've attended your live sessions, you've gone to tutoring or reviewed exams when your instructors have offered it. Okay, I would suggest that you pull out your 3 study guides from exams 1, 2, and 3 to use, as well as this study guide. Okay. You have done several activities over the term that will help prepare for HESI. You've done your 2 evolved case studies, right? Hospice and disaster. You've done 4 sets of NCLEX questions. You're now doing a Kaplan assignment that has rationales. I've provided you with case studies for every chapter, so I would suggest you review those as well. Your discussions have prepped you. Kaplan question, here's something about Kaplan questions for community or good practice. Make sure you take notes during the remediation of each question. The rationales are super helpful. Okay. Med-surg, levels of prevention, nursing process. What else? Safety, ABCs. Okay, so this is broken out into, I think, 10 sections, and each section is highlighted in red, highlighted in yellow. Okay, so this first section is your population groups across the lifespan. So there's a section on infants, children. Here's your injuries and accidents, adolescents, and then specifically women, men, and the elderly. Okay, so those are all your populations across the lifespan. Okay, specialty nursing. What did we learn about? We learned about the school nurse. We learned about faith community nurse, and then we learned about home health and hospice. Okay, so you need to read through those as well. Okay. Next was, what was the role of the nurse? Okay, what is the role? What is our role as a community nurse? And it's broken out into a few sections. Okay, what is the role of the nurse? How do we do a family assessment? Here's your eco map and genogram information. What is our role in prevention strategies for violence? Okay, and what is our role when working with vulnerable populations? Okay, and then here's that information, assessing incomes that we saw on the, I think the community page of that trend sheet. Right, and here's my mantra on poverty, right? We know that there's a link between poor health and socioeconomic status resulted from poor housing, malnutrition, right? So there's your poverty information and how it affects health. Okay. Actually, this section here, when you're working with vulnerable populations, we address several things: poverty, finance, legal and ethical issues, and then negligence. Okay. And here's where we pull in your ethical principles. Remember, it's still under the section of nurses' role in working with vulnerable populations. Okay. Your ethical principles, make sure we know these. And your professional tips. You know, how do you get involved in the community? And then this was all over that trend sheet we went through, which is the program development, program management. Okay, program outcomes. That was a line item on your trend document. Program outcomes. Okay. Aspects of program, evaluation of program outcomes. That was a line item as well. So we created the study guide based on that trend document. So that's why, you know, connect the dots. How do we evaluate outcomes? Remember, that was one of the line items. How do we evaluate outcomes? Okay. And then infectious disease was another section. We just talked about the triangle. Okay, and here it is. I don't know who needs to be muted, but could somebody mute themselves so everybody doesn't have to listen to background noise, please? Really appreciate it. Thank you. Okay, here's your epidemiological triangle information, your agent, host, and environment. CDC reportable diseases, that was a line item. And so we tried to take the line items and put them in the study guide and give you more information. Like, well, when I asked you, what do you think they're talking about when they say CDC reportable diseases? Well, I was hoping that you read through the study guide and that this was the answer. All right. What they're different in each state. What are national notifiable diseases are reportable in your state? Where do you find them? Go to your state health website, state or public health website. So these are the answers to those line items. And that's what this study guide is made up of, the answers to or giving more information about what those line items might be. Okay, and here's the whole section on TB. Page 24. Okay, it goes through exposure, perform a test. How do you interpret the test? Okay, so you gotta read. This is the information on that line item about TB. Okay, difference between endemic and epidemic. Modes of we're in the section of infectious disease now. Okay, so it's specifically broken out into different sections for you. Okay, TB, let's see, modes of transmission. Most STDs are spread by sexual contact. Okay, vectors, and here's the whole section on anthrax. 3 types of anthrax. It goes through the 3 types. It goes through exposure symptoms. It goes through treatment. And here's the radiation exposure, right? That was a line item in your trend document. Okay. Next section is disasters. Goes through the nurse's role in disaster in the whole cycle: preparedness, response, recovery. Okay. Preparedness. What is the role of the community nurse? And before in preparation. Here's your American Red Cross. 3 levels of preparedness. Okay, what are our stages of a disaster? I call it the cycle, but preparedness, response. Who's responding? Here's all the information about FEMA, Red Cross, right? And then our response plan, and then recovery. What's our role in recovery? So preparedness, response, recovery. So all those line items, there weren't that many in the trend document for disaster, but all those line items that were there are all explained right here. Okay, and this is actually good. Levels of prevention related to disaster management. What does a primary prevention look like? What is a secondary? What is a tertiary? There's several examples of primary, secondary, and tertiary. I think there's one of these in each of the sections in this study guide. So make sure you take a look at it. Okay, so for all the 10 sections that we break out in this study guide, there is a example of a primary, secondary, and tertiary. Okay. There was a line item about bioterrorism. Here's the extended information about that. Okay, what are the bioterrorism agents? Okay, here is your, we're still in the disaster section, but I want to show you, here's our cholera information right here. Page 35. Okay, it's in the disaster section. That was the first line item on the disaster trend sheet. Why? And that's why I said, why are they asking about cholera? Well, here you go. Okay, triage. Okay, so on page 36, here's your tag. Remember we had a line item on red tags. Well, here's our tag system. You know, as nurses in the community, when a disaster happens, we are expected to be able to perform in any stage: response, recovery. And if we're participating in the response, we need to be able to know how to triage. This is, so they're asking a question about triaging. And on our document, it said red tags. So, but the next HESI could be yellow tags or green tags. So know your tags. What are they? Right? Red tags are people who can't survive, right? Okay, they can't survive without immediate treatment. Okay, green tags are the walking wounded. Okay, so just know your tags. And then our next section is culture. This is all about culturally competent care in different cultures. Okay, you review that. Goes through all of what we went through in class. Okay. This is almost, yeah, this is almost, this is, a lot of this information was on our study guide for the culture chapter. Okay. And then rural versus urban. What's the difference? So this is where it talks about migrants, risks of what community, what is the rural community at higher risk for? Right here. Okay. How do we define a rural community? Population characteristics and cultural considerations for rural populations. I know it says rural versus urban, but I think that's a little misleading. This whole section is really focused on the rural community. I mean, it does have a couple of connections that the rural population has less resources than the urban, but it doesn't really give a good description of urban community because we're focused on the rural. So when you read through this section, it really is all about rural populations, the health status. Why are women more at risk? And always remember when you're reading through this section that you're in the cultural section or the rural section. So when you read women's health, including maternal infant health, this is not a general statement for all women's health and maternal and infant health. You're in the rural section. Pardon me. So we're talking about rural population. Same with the health of children, right? Urban children, we know, are more likely to see a pediatrician when they're ill. Okay, so there are some references to comparisons to urban versus rural, but this whole section is very much focused on rural. Okay, occupational environmental hazards in rural areas, rural healthcare delivery. Here's a whole section on migrant farm workers. That was one of our line items on the trend sheet we just went through. What's the migrant lifestyle? What does their housing look like? Okay. I think this is the last section, federal agencies. What do we need to know? You know, who do we depend on in public health? Well, we depend on Department of Health and Human Services. What do they do? Within the Department of Health and Services, what are the two agencies we want to know about? Okay, these are the two of them. What's OSHA? Remember we talked about that? What's the difference between OSHA and NEOSH? NEOSH conducts the research. They're kind of the big picture. They conduct all the research, make the recommendations, and then OSHA is the one who implements them, who enforces them, who monitors them. And here's the section on voluntary and nonprofit agencies. And here we're talking about Medicare, Medicaid, charities. So that line item of voluntary agencies, here's the explanation of it. And the last section is community assessment. Okay, and there was a whole right here. That's the first line item we talked about is why is community assessment important? Well, here's a whole section of it. Okay. So, okay. So, we're not done yet. We have one more thing to cover. Everybody doing okay? Is this helpful?
Yes,
Yes,
very.
ma'am. Yes.
Yes.
Okay, so the study guide is not new information. This is information we've covered over 9 weeks. Okay, the trend document, internal document we went through earlier supports the study guide. Let me rephrase that. The study guide is an extended version of the trends document we just covered at the beginning. Does that make sense? So there should be hardly anything on the study guide that you're unfamiliar with. If you are, then you need to go back and do your due diligence and become familiar with it or become more familiar with it. Okay. I just want to go, you guys all received this, but what I did yesterday, since I had so many extra students, I'm going to make it easy for you. I'm going to just take this. I hope I can do it right. Copy this and put it in the chat. Okay. Oh, I'm not sharing my screen yet. So hang on. Where's the chat here thing? Chat. Where is it? Okay. I'm putting this document, even though you all received it, but I'm trying to prevent you from going back. All right. So I just posted in the chat the document I'm going to cover. Okay. You all received this, but I don't want you to have to go back looking for it. You received a lot of test taking strategy tutorials. This one I want to pull out because critical thinking fundamentals practice questions. Okay, these are like the HESI and CLEX questions. Want to make sure you understand how to break down a question. You may know this, you may have already seen this, but I always think it's good to go through it. There are 10 questions. We may not get to all 10. So that's why I'm giving you the link, is I would like for you to go back and finish this exercise. Does that make sense? I would like you to go back and finish it. It's good practice. So I want you to go back and finish this exercise. If we don't finish it, I sent you the link, and I want you to do the HESI practice exam. Okay? I can't stress enough how important those additional resources are for you. And Mary Jo already told us that she did it and it was very helpful. Mary Joy. Okay, so let's go through this. Okay, we have 10 practice questions at the fundamentals level. Okay, we have some HESI hints to include to help how to help you think about through each question, right? And then we have rationales that are included to help us complete our thinking process. Okay, so let's go through number 1. Okay, and here are the HESI hints that we want to think about. So let's read the question first. A male client with dysphagia. What's dysphagia?
Trouble communicating.
And
Swallowing.
Eating.
thank you. Male with dysphagia is eating lunch in the dining room of a long-term care facility. The nurse observes that he is choking and coughing excessively while eating. Okay, well, if he's coughing while he's choking, that's still okay. Which nursing intervention should the nurse implement? Okay, so here's your hints first. Don't look at A, B, C, D yet. Here's our hints that they're going to give you on every question. Does the question have a positive or negative focus? And here it tells us this question is a positive focus because they're trying to implement an intervention. They're trying to make the situation better. Okay, what are the key words in this question? Dysphagia, choking, and coughing. So knowing, and this is just a tutorial, knowing what the key words are, can you in your mind rephrase the question? Okay, so the question up here is which nursing intervention should the nurse implement? Well, after pulling out the key words, maybe in your mind, you rephrase it as, what should the nurse do when a dysphagic client is choking and coughing? And then the fourth hint for HESI is, can you rule out any answers right off the top? Okay, so in this case, they can rule, why can they rule out A? Why could you rule out A immediately? And D, start with A.
Don't want to feed them quickly.
Right, he's already choking. So that's a no-go. What about D?
He's choking, adding water is not really going to help.
Exactly. So by doing this little strategy, you already have 2 answers that are out the door. Right? So now you're down to B and C. What's the correct answer and why?
B.
B?
C.
Read B closely. Why is B wrong?
Because you want to tilt his chin down, not up.
Oh.
Go. ABCs. Okay. This is a chin up. We don't want a chin up, right? We want chin down. So what's the right answer?
C.
Okay. Okay. And you know what? I want to keep going through the questions. So I'm going to ask you guys to go back and read through the rationales. Okay. Here's the right answer. Transport the client to a quieter environment to finish eating. It's going to be up to you to go back and read the rationales. Okay. And that way I know you'll look at this document. Okay, let's go to number 2. The nurse assesses that a client, and this isn't so much for the, well, it is for the clinical knowledge, but it's how to break down questions using these HESI hints. Is this helpful to you guys, or do you guys already know this?
This is very helpful.
Helpful.
It's helpful.
Okay. Nurse assesses that a client's radial pulse volume is 1+ on a scale of 0 to 4. What action should the nurse take to most accurately count the client's pulse rate? So we know that this is a positive question because an action is a positive question. We're trying to get towards resolution. What are the key words in this question? Well, pulse volume of 1+, right? And here, accurately count rate. Okay, so knowing that, let's try and rephrase this question. The question is, what action should the nurse take to most accurately count the client's pulse rate? Well, knowing that we've pulled the key words out, maybe a rephrase in our brain is, what is the most accurate way to count the pulse of someone with a weak pulse? And so if we rephrase it like that, can we rule out any answers? Well, definitely we can rule out D. Why is D wrong? Come on, you guys.
It's unrelated.
Correct.
You don't want
D's not even related to counting a pulse rate. So now we have 3 options, A, B, or C. What's the right answer? Think med surg here.
It's B.
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 Why?
Because if they have a weak pulse and you want to get an accurate pulse, you need to listen to their apical for a full minute.
Bingo. Excellent. Excellent. Yep. And you can read the rationale, but B is the correct answer. Good job. And please go back and read the rationales if you're not understanding why the rationales in this exercise, in this tutorial, go through why the answer is correct and why the others are incorrect. Okay, ambulatory female who is alert and oriented refuses to take a shower because she is experiencing menstrual bleeding, but states that she would like the nurse to assist her with a bed bath. Okay, what action should the nurse take first? Okay, so does the question have a positive or negative focus? Well, it's asking about action, so that's positive. Okay, what are some key words that were pulled out of here? Well, they pulled out ambulatory, right? She's walking around, she can walk around, she's alert, she's oriented, and she refuses due to menstruation, right? So maybe we rephrase the question. The question they're asking is, what action should the nurse implement first? And remember, this is a priority question first. All right. All the answers potentially could be correct, but what do we want to do first? So to rephrase it, what is best to do for an alert ambulatory client who refuses a shower? I think that's excellent rephrasing of the question. Okay. And so here we can rule out C. All right. Why can we rule out C?
Because you don't document first, you do that after everything's done.
Correct. And you haven't really done any interventions yet, right? You haven't really talked to them and explained and done teaching and all that. You don't want to jump right to documentation. You want to try and problem solve. Okay, so C's out. What? Okay, so A, B, D. What's the right answer?
I'm going with D.
D.
You're starting out with a primary intervention, correct? So it's D. Instruct the client about the benefits of showering. Okay, and then go from there. If she still doesn't want to do it, then what do we do? But that might be all you need. All right. Because we're trying to increase her independence, increase her hygiene. She's alert, she's oriented, she's ambulatory. No reason why she shouldn't be getting up and taking a shower. Okay. Next, and again, go back and read the rationale. which situation warrants the nurse's most immediate attention? Again, it's a priority question. Most immediate. Okay. The client who is receiving what? So it is a positive question because we're looking at most immediate. What is the key word? Most immediate. That's priority, right? So what could be some rephrasing of the questions? Well, which situation is most critical to the client? They're asking who needs care urgently? That's the way I'm reading it. Which client is at greater risk of loss of physiologic integrity? Which client is not in a safe situation? So those are just examples. You may rephrase it differently, but for me, it would jump out as who needs help the quickest? I mean, that would be my first stab at a rephrase within the first 5 seconds. Okay, who needs help? It's a priority question. Who needs immediate attention?
A.
Right. Okay. And why do we rule out C and D first?
Those aren't emergencies.
They're not emergencies. An infiltration of normal saline is not critical, nor is an IV obstruction of D5W not critical. But anaphylaxis sure as heck is. So good. Okay. Okay, nurse is observing a mother administer eye drops to her 2-year-old. Which action by the mother indicates the need for reteaching the skill? Okay, what's important about the way this question is asked? What do you have to read into this question?
You have to look for the wrong answer.
Exactly. Okay, so when they say, what indicates reteaching? I don't know whether it's for anything. That means, what are they doing wrong that they need reteaching of? All right. And so if you look, just skip right down to rule out A, B, and D, you can already rule out 3 answers because these are all effective age appropriate techniques. What the question is asking is, what is she doing wrong that may need some reteaching? Okay, so don't read these questions quick enough to not understand that this question is saying, well, and the other thing too is if you start reading through the answers and 3 of them are the correct way to do it, then obviously you have to go back and read the question saying, well, 3 of these are correct and it's not a select all that apply. So it must be what's wrong. Does that make sense? Okay, so if we're ruled out A, B, and D because they're all effective ways to give eye drops, age appropriate ways, then all we have is C. The mother applies gentle pressure over the child's eyelid for 1 minute. Obviously, that's the wrong answer. And she needs re-education. Okay. Klein's vital signs are temp 99, pulse 98, respiratory 14, BP 160/90. Which prescription would the nurse expect to hold? What does hold mean in terms of this question? What does hold mean?
What medication we're not going to give?
Not give. Right. Okay, so look at the vitals. Okay. Keywords, they identify vital signs as keywords, right? So we need to be mindful of the vital signs. So maybe a rephrased question based on the vital signs, which medication should not be given? Okay. We know that A and C can be ruled out because we don't give narcotics for respiratory rate less than 12, and the respiratory rate here is 14, right? We know that cardiotonics are held for a pulse less than 60, wouldn't apply. Pulse here is 98. So we're down to 2 potential answers, C and D. Is the temp high enough for Tylenol?
No.
No.
That's correct. So the correct answer is Tylenol, right? And the rationale is that it's administered fever, but not generally administered for a low-grade fever of 99. And Lasix, we don't know anything about Lasix. We don't know, we can't even, by process of elimination, we know that B is incorrect. So therefore it throws D out. And we've already taken out A and C. Okay. Let's do one more. The nurse administers a PO analgesic that has nausea as a side effect. In planning care, what is the best action to assign to the unlicensed UAP? Okay, so what is this question asking? What can we assign the UAP, right, with regards to medication administration? And the key word is it's a UAP, right? Well, we know A's out the door because UAPs cannot administer meds, right? We know that D's out the door because not only are they not giving meds, if they're not giving the med, they shouldn't be the one charting it.
Can rule out C because UAPs can't evaluate. So the answer is B.
Oh, you guys are smart. Yes. Yes. And here's your answer. UAPs do not administer medications, assess clients, or document. Okay. We'll do one more, couple, how many more do we have left? We'll do one more. 60-year-old client states, I'd like to be able to see the glass as half full instead of half empty. What action is best for the nurse to implement? So what do we know? We know that he wants to look at the glass half full, which typically suggests that he wants to be more positive, right? So I'm rephrasing the question in my mind to say, what action will best help the client who wants to feel more positive? What can I do to help? Right? It's obviously a positive question because we're trying to find the best action, right? And keywords, well, this is a 60-year-old client, and how does he see the glass? He knows what the meaning of half empty and half full is, and he wants to try and see it half full. So what are we gonna try and help him with? Right? Well, we know that we can throw out D, right? Assure that the client this is a normal feeling as retirement approaches. No, not necessarily. No, that's not true at all. They might be retiring for different reasons. Okay, so D's out. What else can we do? What would be the right answer? Well, we don't know that we need an antidepressant yet. What's the right answer?
A.
Why? Why A?
Because you're trying to get them to think in a different way.
Do we agree with that, guys? Excellent. Excellent. Yep. Right? Cognitive restructuring is an effective strategy for changing one's perceptions. Excellent. Okay, so do we see where we're going with all this? Can you see how all the dots are connected here?
That was very helpful.
Okay. Your trend sheet connects the dots is the study guide. Okay. Your 3 study guides, exams 1, 2, and 3 are part of the HESI study guide. It all connects. This isn't you are not expected to have any new knowledge here. I mean, some of the line items in the trend sheet might be new information, but they're under a topic we've already covered. So you're going to have some research and information to do on your own. Okay. But all in all, it's really structured, and you really don't need to be out reading books and, doing different, you have all the resources right in front of you. Okay. You have your test taking tutorials that I sent you midterm. I've just put in the link in the chat, the link to this particular one. Maybe finish this one, go back and read the rationales. Go do your practice HESI test. Okay. I'm not sending it to you just so that more work to do. I'm sending you because it's helpful. Pay attention to your Kaplan this week. Don't just remediate to remediate and spend 1 minute, because everybody knows that, if you spend 1 minute, you get credit for it. Spend more than 1 minute. Take good notes. Go back to your NCLEX assignments. Look at all those rationales. Everything's right in front of you. You don't need to go outside our little class. You don't. Questions? Helpful? Too much information, too little information, disorganized, organized? What are you guys thinking?
Very helpful.
Thank you. That was good.
Okay. So I will send you the record. I'm going to stop recording now because we're done. I will send you